Good morning, everyone. My name is Momina, and the topic of our group presentation is schizophrenia and other psychotic disorder. So, first of all, I'm going to discuss the introduction. Schizophrenia and other psychotic disorders are mental health conditions characterized by disruptions in thinking, perceptions, emotions, and behavior. Schizophrenia is the most well-known psychotic disorder marked by symptoms such as hallucinations, delusions, disorganized thinking, and social withdrawal. Other psychotic disorders, such as schizoaffective disorder, brief psychotic disorder, and delusion disorder, share some similar features but differ in duration, severity, and specific symptomology. These disorders can significantly impact a person's ability to function in daily life and often require ongoing treatment and support. The local prevalence of mental disorders in Pakistan is as high as 10%, affecting approximately 20 million Pakistanis, and mental illness is associated with huge economic burden. The exact prevalence of schizophrenia in Pakistan is not yet known, however, it is estimated at between 1 and 2%. Schizophrenia affects approximately 24 million people, or 1 in 300 people, which means 0.32% worldwide.
Schizophrenia. Probably the most well-known psychotic illness is schizophrenia. Numerous symptoms are present, including as delusions, hallucinations, disordered thinking, and poor social functioning. Hearing voices, believing in conspiracies without proof, and speaking erratically are a few examples of schizophrenia. Schizoaffective disorders. This condition combines aspects of mood disorders, such as manic or major depressive disorders, with signs of schizophrenia. In addition to mood disorders, people with schizoaffective disease also exhibit signs of schizophrenia. For example, they might experience manic or depressive episodes along with hallucinations. Brief psychotic disorder. Usually lasting than a month, brief psychotic disorder is typified by an abrupt onset of psychotic symptom. Trauma or a traumatic situation may set this off. An illustration would be someone who, after the death of a loved one, experiences delusions and hallucinations that go away in a matter of weeks. Schizophrenic form disorder. This condition is comparable to schizophrenia but lasts for a shorter period of time. The duration of symptoms ranges from 1 to 6 months, after which the person may either fully recover or experiences a progression towards schizophrenia. A person who experiences hallucinations, delusions, and disordered speech of a few months before getting back to their normal level of functioning could serve as an example. Delusional disorder. People with delusional disorder often do not exhibit other psychotic symptoms like hallucinations or disordered thinking, but they do not have one or more personal delusions that last for at least a month. These illusions might be either weird, very unlikely, or non bizarre, believable but untrue.
Next up, we have the risk factors for schizophrenia. First of all, there are social relationships. Schizophrenia can strain relationships, causing social withdrawal and isolation. Self care and daily living. Basic tasks like hygiene, meal preparation, and managing finances can become extremely challenging. Next up, there is cognitive functioning. Schizophrenia often leads to cognitive impairment, which affects the memory, attention, and decision making abilities. Emotional dysregulation in schizophrenia results in intense mood swings, making it difficult to manage emotions. And at last, there are sleep disturbances, which are very common in schizophrenia. They disturb sleep patterns, and which leads to fatigue and impairment in daily activity.
Common symptoms of psychotic disorders include disorganized abnormal motor behavior, which refers to unusual or inappropriate movements that can be unpredictable and purposeless. Examples include catatonic behavior. Then comes hallucinations, which are the sensory experiences that seem real even though they aren't there. These involve five senses: auditory, visual, tactile, olfactory, and gustatory hallucinations. Then comes the delusions. These are the false beliefs that a person holds onto firmly even when there is evidence to the contrary. Examples include persecutory delusions and delusions of reference. Then comes functional impairment, which refers to how symptoms of psychosis disrupt a person's ability to function in daily life, which includes difficulty holding a job. Schizophrenic patients commonly shows these three symptoms. The first one is affective deficit, which refers to reduced ability to experience or express emotions, which may exhibit blunted affect and restricted range of emotions. Then comes avolition, which describes a lack of motivation, and communicative deficits, which encompasses difficulty with communication, both verbal and non-verbal.
Various treatment approaches for schizophrenia offer hope in managing symptoms and improving well being. For example, antipsychotic medications are vital in treating schizophrenia. By rebalancing neurotransmitters, particularly dopamine, they alleviate hallucinations, delusions, and disorganized thinking, improving daily functioning. For example, chlorpromazine and risperidone, they are a cornerstone in comprehensive treatment plans alongside therapy and psychosocial support. Moreover, psychosocial interventions are also very helpful. For example, in cognitive behavioral therapy, individuals identify and challenge disordered thoughts, developing vital coping strategies. Family therapy educates and empowers families, fostering better communication and problem solving skills. Supported employment and education programs provide crucial assistance in finding and maintaining employment or education opportunities, promoting independence and integration. During severe cases or acute psychotic episodes, hospitalization may be necessary for stabilization and safety. Crisis intervention teams provide immediate support during crisis. In addition to this, psychiatric rehabilitation programs help individuals regain skills and independence in daily life through social skills training and vocational rehabilitation. Furthermore, a comprehensive integrated approach combines medication therapy and psychosocial support tailored to individual needs, benefiting many with schizophrenia. Lastly, ongoing research explores new treatments from novel medications to brain stimulation techniques and digital therapeutics, offering hope for improved management for schizophrenia. Most important of all, adherence to treatment and regular symptom monitoring are crucial. Collaborating with healthcare providers ensures effective management of symptoms and side effects.
Age of onset. Although it can appear at any age, schizophrenia usually first manifests in their late adolescence or early adulthood. Males often experience the start in their late teens or early 20s, while females typically experience it slightly later in their early to mid 20s. Gender. Although both sexes are susceptible to schizophrenia, there are some distinctions in the onset age and symptom presentations. In comparison to females, males frequently have more severe symptoms and early beginning. On the other hand, other data indicates that women may experience a better course of illness. Ethnicity. Diverse ethnic groups exhibit schizophrenia at variety rates and in diverse ways. For instance, research indicates that some ethnic minorities in urban locations are more likely to experience schizophrenia. The precise cause of the variations, which are probably impacted by a mix of genetic, environmental, and socio-cultural variables, are not entirely known. Genetics. A major contributing factor to the onset of schizophrenia is heredity. People who have a family history of schizophrenia are more likely to experience the illness themselves. The precise genetic pathways at play are complicated and not entirely known, though. Geography. Although schizophrenia is a global illness, there may be differences in prevalence and presentations in various nations and areas. These discrepancies may be caused by cultural variables, variances, and diagnostic procedures, and and access to healthcare.
Mental disorders have long been misunderstood and misrepresented in popular culture, perpetuating myths that fuel stigma and discrimination. These misconceptions can not only affect how society perceives individuals with these conditions, but also impacts their access to support and treatment. Let's address some common myths surrounding schizophrenia and other psychotic disorders. Individuals with schizophrenia aren't usually violent, but they are rather victims of violence themselves. Treatment is available even where mental health is misunderstood. Psychotic disorders aren't limited by culture or status, they can happen to everyone. Substance abuse can trigger symptoms, but various causes exist. Mental illness isn't contagious or solely hereditary. Such conditions can be effectively managed with medication, therapy, and support services. Many individuals with schizophrenia or other disorders can lead fulfilling lives with appropriate treatment and support. Let's discuss two cases that showcase what these disorders entail. A 19-year-old male presented with severe arm pain and symptoms of paranoia, including electropendedic impulses and persecutory delusions. He believed that he was controlled by the government and stalked by agents due to a chip in his arm. Despite initial reluctance, he agreed to psychiatric evaluation, marking the beginning of its schizophrenia management journey. This emphasizes the importance of timely recognition and intervention for psychosis. Another case showed that a 31-year-old motor courier experienced severe anxiety and delusions during the COVID-19 pandemic. His paranoia led to erratic behavior, prompting law enforcement intervention. Despite normal examinations and negative PCR results, he was diagnosed with brief psychotic disorder. Over time, he improved his mood and reduced psychotic symptoms, and after 17 days of hospitalization, he was discharged with clinical remission, marking a significant milestone in his recovery.
So, by concluding, these are three evidence-based resources and the references which we have used. The first one is from WHO, the next one is National Institute of Mental Health, and the third one is the American Psychological Association. Thank you.